After determining heart rate, rhythm and axis, we have to examine each wave of ECG. In this video, we will discuss about P wave. This is normal ECG waveforms, showing all waves and segments. For this video, we will be focusing only on P wave. P wave is first positive deflection on the ECG. It represents atrial depolarization. Normal duration of P wave is less than 0.12 seconds. Characteristic of normal P wave. Morphology, smooth contour, monophasic in lead 2 and biphasic in lead V1. Important points to remember. P waves should be upright in lead 1 and 2. Inverted in lead AVR. Amplitude. Less than 2.5 mm in the limb leads, less than 1.5 mm in the precordial leads. Atrial abnormalities are most easily seen in the inferior leads 2, 3 and AVF and lead V1, as the P waves are most prominent in these leads. Question to be asked when we are examining P wave. Are any P waves absent? Are any P waves inverted? Are any P waves too small? Are any P waves too wide? Absent P wave. Completely absent P waves in whole ECG causes atrial fibrillation, sinus arrest or SA block and hyperkalemia. In this ECG strip, there is absence of P waves along with irregular RR interval, which is suggestive of atrial fibrillation. Another ECG of atrial fibrillation showing absent P waves, irregular rhythm and fibrillation waves in lead V1. P waves will also be completely absent if there is prolonged period of sinus arrest or SA block. In SA block, SA node depolarizes but the impulse does not reach the rest of atria. And in sinus arrest, SA node does not depolarize at all. In few conditions, P wave is present but not easily identified. For example, in sinus tachycardia, third degree AV block, or in atrial flutter. It is very common for P waves to be present but not immediately obvious. Before concluding that P wave is absent, carefully examine lead 2 and lead V1. P wave are best seen in these leads. P waves will often be hidden by any rapid tachycardia. P waves may also occasionally be hidden within the QRS complex or T waves in third degree AV block and in AV dissociation. At very high atrial rates, such as atrial flutter, P waves may not be apparent because they become distorted. Another abnormality of P wave is inverted P wave. P wave usually upright in all leads except in lead AVR. Abnormal P wave inversion indicate wrong electrode placement by the technician, dextrocardia and retrograde atrial activation. Now, next P wave abnormalities are related to its morphology. Revise the important points of P wave morphology. It's upright in most leads except in lead AVR and lead V1. P wave normally inverted in AVR and biphasic in lead V1. It has normally single peak and it is not notched. It is less than 2.5 mm in height and its width is less than 3 mm. Abnormalities in P wave morphology include tall P wave. Tall and peaked P waves indicate right atrial enlargement. It is also called as P pulmonale, because right atrial enlargement is often secondary to pulmonary disorders. This is the ECG showing tall P waves in lead 2, that is P pulmonale, suggestive of right atrial enlargement. Common causes of right atrial enlargement includes primary pulmonary hypertension, secondary pulmonary hypertension due to chronic bronchitis, emphysema, massive pulmonary embolism, and pulmonary and tricuspid stenosis causes right atrial enlargement. Another P wave abnormality is wide P wave. Normal P waves are less than 0.12 second, that is, less than 3 small square in duration. Wide and notched P wave indicate left atrial hypertrophy, also known as P mitrale, as mitral valve disease is a common cause of this abnormality. This is another ECG suggestive of left atrial enlargement. Causes of left atrial enlargement. Isolated left atrial enlargement is seen in mitral stenosis. Left atrial hypertrophy along with left ventricular hypertrophy causes includes systemic hypertension, aortic stenosis, mitral incompetence, and hypertrophic cardiomyopathy. Biatrial enlargement. Biatrial enlargement is diagnosed when criteria for both right and left atrial enlargement are present on the same ECG. The diagnosis of biatrial enlargement requires criteria for left atrial enlargement and right atrial enlargement to be met in either lead 2, lead V1 or a combination of leads. Criteria for biatrial enlargement. In lead 2, bifid P wave with amplitude of more than 2.5 mm and duration of more than 120 milliseconds. In lead V1-V2, biphasic P waves with initial positive deflection more than 1.5 mm tall and terminal negative deflection more than 1 mm deep and terminal negative deflection more than 40 milliseconds duration. And combination criteria includes P wave positive deflection more than 1.5 mm in leads V1 or V2 and notched P waves with duration more than 120 milliseconds in limb leads V5 or V6. This is the P wave morphology in biatrial enlargement. ECG of biatrial enlargement. This is the summary of P wave morphology in right, left and biatrial enlargement. Do not get confused with biatrial enlargement criteria. Just remember important points, that is cause of absent P wave, inverted P wave, tall P wave and wide P wave. Thanks for watching. Do not forget to subscribe.